Hi, this is Dr. Jim Anderson, and I'm here to talk to you about a condition called drop foot. And I think we need to start out by just defining what is drop foot. Drop foot is simply the concept, if you were to look down at your foot, it's a situation where you have weakness, and it's very difficult for you to pull your foot up, maybe pull your toes up, or pull your foot sideways. In other words, if it's your right foot, it'd be your right foot moving away from your left foot. So, and it doesn't have to be both. It could be a little bit of one and a little bit of the other. And it can be very mild. Sometimes it's so mild that your symptoms might be that I just feel a little bit weak, like my ankle wants to sprain. Sometimes it can be very severe. You might even need a brace even to walk because it's that severe. But what happens sometimes in medicine is patients, as they get older, need to have a hip replacement. Very common procedure. Or maybe a knee replacement. And these are really good procedures, by the way. I think they can work very well. The story I always hear from patients is when they have them done, a lot of times they're saying, gee, I wish I'd have done it earlier if I knew how much it helped. And so, and I think that the techniques have been vastly improved. But one of the possible complications of either knee replacement or hip replacement would be a drop foot. So, and you're oftentimes even told that by the surgeon. So I want you to understand that we have seen these cases, and oftentimes we can provide help for you. So here's the idea. When you're told that you may have this happen from a surgery, the surgeon will oftentimes explain that when we're in there, we might stretch the sciatic nerve. And you may know the sciatic nerve starts in the low back, goes down kind of in the buttock area down to your knee. Okay. So if you get a drop foot afterwards, a lot of doctors will look at the back. They'll think, well, maybe there's something in the back, maybe there's something that can be done. They'll do an MRI of the back, there's nothing wrong. But what we found is that we look into the lower leg. Right below the knee joint are two nerve tunnels, one or two. And those nerve tunnels are where the two main branches, okay? Are you following me so far? The two main branches that come off the sciatic nerve above the knee, the sciatic nerve divides into two branches, and then down in the upper leg is where these two branches go into tunnels. These nerve tunnels can be kind of tight on the nerve. So that works as an anchoring point. So if you can just visualize what I'm saying, now if you pull or stretch on the sciatic nerve and those tunnels are slightly tight, it's going to damage the sciatic nerve and you get a drop foot. So what we do, we surgically sometimes can go in and open up these tunnels. And sometimes it's just a 20-minute procedure, maybe a 40-minute procedure. You can walk the next day. And we've seen people that have had drop foot for 5 years from the hip replacement, and we're still able to help them, or maybe it was 6 months ago. But it's just something I want you to know about, and it's an opportunity maybe you ought to look at, because the risk of a drop foot can be pretty severe if you're an older patient, because oftentimes that's a situation that could lead to a fall, break a hip, and you know what can happen from there. So just something to consider. It's an option that you need to look at, I think. So call us if you have any questions, and please visit our website at andersonpodiatrycenter.com.